All right, now let's see salivary gland tumors. Classification of salivary gland tumors. So they are broadly classified into benign epithelial tumor and malignant epithelial tumors. So the benign ones are adenoma. Under that, pleomorphic adenoma and monomorphic adenoma comes. And then under monomorphic adenoma, there is oxyphilic adenoma and adenolymphoma. So this is benign epithelial tumor. And then malignant epithelial tumor, there is mucoepidermoid carcinoma, acinic cell carcinoma, adenocystic carcinoma, adenocarcinoma, and undifferentiated carcinoma. This is the malignant classification for salivary gland tumor. Easy, isn't it? You just have to remember a few things, which you eventually will. Now let's see in detail about mucoepidermoid carcinoma. So first, what we say about this is it comes under malignant epithelial tumor. So we write that it is a malignant epithelial tumor of salivary gland, and then it is composed of mucous cells and epidermoid cells. As the name says, mucoepidermoid. Muco means mucus, epidermoid means epidermoid cells. So the mucous cells and epidermoid cells are present, and it also consists of clear cells as well as columnar cells. And cystic growth is also observed. It is a histopathological feature. We're just writing here, to get more points. So this mucoepidermoid carcinoma is a common salivary gland malignancy, and it is commonly seen in parotid gland area, palate, buccal mucosa. Now let's see the clinical features. So the females are mostly affected than the male, and it occurs in, as we saw here, palate, parotid, buccal mucosa. And then the age is around 30 to 40 years. The average is 47 years. And then the clinical presentation are slow growing, painless, partially encapsulated, contains cyst. Okay, so it is slow growing, painless, partially encapsulated, and contains cyst. If we see the histopathology, so they originate from pluripotent reserve cells of excretory duct. This is a point which you have to keep in mind. Pluripotent means the stem cells. They are capable of differentiating into any cells. So they originate from the pluripotent reserve cells of excretory duct. Now, the mucous cells, as we know that there is mucus and epidermoid cells, so the mucus will be pale and foamy, with pale and foamy cytoplasm, and the epidermoid cells show the squamoid feature, and there is growth of cyst. So this is the histopath. I'm just showing a part of the histopathology. So these are the mucous cells, and pale cytoplasm, and then this is the cystic growth, and these are the epidermoid cells. So when you shade with the using pencil, just make it a little bit light over here, so it depicts the pale foamy cytoplasm. Now, coming to the grading of mucoepidermoid carcinoma, it is low grade, intermediate grade, and high grade. Now the treatment is conservative excision with preservation of facial nerve.